And thank you for joining us with this video today to provide an update on the first confirmed case of COVID-19 within our local prison system, the Ohio Reformatory for Women. We want to take this moment to sort of explain what that looks like in terms of both the contact investigation and the control of the infection within the facility and the various roles that each partner will play with that. It's worth noting some of the steps that ORW has already taken to monitor and manage for infection within their facility. So for several weeks, all the way back to mid-March, they've developed plans to deal with possible infection within the facility. Those plans include the automatic quarantining of any new resident who's coming into the facility for 2 weeks to try to monitor for disease. It also includes the testing of all new individuals who are moving into the facility. So for the first case that was confirmed over the weekend, we actually know that they were pulled as part of that initial screening. So they arrived, were transferred from another facility to ORW, and upon arrival were tested for COVID-19. And so they were actually screened and already in quarantine. So their exposure to the greater population of residents who are incarcerated within ORW is limited as part of the normal protocols. And all of that that's occurring within the prison itself, within the walls of ORW, that is managed and directed, including infection control, the health care, all of that will be managed by our state partners. So the DRC, Department of Rehabilitation and Correction, will work with state-level partners to manage that population's response. And that is how it typically goes. And we've seen that response in other locations. Now, we do have a branch within the emergency operations centers that liaisons directly with ORW, and that has been functional for several weeks. So we have a good partnership, and as they need assistance from our broader community with their response, we will certainly be in a position to provide it. Once you go outside the walls of ORW and you're dealing with the response in the community, it's really no different than it would be for any other case of COVID-19 or contacts of a case of COVID-19. So within the community itself, if we have staff or guards who were exposed to that case and they are now in our community or adjacent communities, because it's not just Union County that may have staff who reside here, then we would work with our state partners on that contact investigation and that control for those community members who are at risk because of the exposure. And that's really no different than what it would look like in most congregate settings, whether it be a nursing home, whether it be a college dorm, or whether it be a prison, as ORW certainly is. So that process still relies on a strong partnership between ORW, state facilities, state agencies, and the local health department and local agencies to manage the response. But it has clear delineated roles for who is over each aspect of it. So one agency, DRC, manages within the prison system. Local health department, in collaboration with our state partners, will manage the response in the community. So with that, as you're looking over the next few weeks, you will see the numbers being represented in two ways. You will see our community numbers of COVID-19 cases. You will also see our incarcerated population number of cases. And so be aware of those. They may not always match up exactly with how the state reports for a variety of reasons, but that is how we will report our case counts within Union County. As always, continue to follow us on our social media platforms or reach out to our office directly with any questions. Thank you. Stay safe. Stay healthy.